Yeah, it's super fun to be here at NSAC because I think it's been, obviously pre-pandemic for all of us, but I don't always make it to NSAC every year, and I started out as a rape crisis advocate, and this has been my jam for like 20-something years, so it's so fun to be here this year and see all of my new and old colleagues, not old age, maybe all of us are a little aged, but it's really fun to be here. And I'm very excited that you're all here at 9 a.m. to talk about data. Woo! Somebody did a woo when Mina was introducing us. I'm like, where's that person? That was you, all right. And we've rewarded the folks for sitting in the front by giving you all your worksheets. We're gonna do that at the end. We're gonna try and be real good on time. We try and do trainings that are like real and down to earth, and workshops like this where we just like make it a conversation. And yet, when preparing for this, we're realizing that data equity is a big topic, and we're gonna pick through it a little bit. So I am gonna actually read off my notes, which I don't usually do, so I'll try and still be interesting and not a total drag. You're never a drag, so we don't have to worry about Tiana. Yeah, so thanks for being here. Let's see if I can get this right. We're using Canva for this, and it's like multiple screens, so bear with us. I think it's gonna work though. Yes. So I'm Wendi Siebold, and my pronouns are she or they. I grew up in California. I'm from LA. I went to Cal. I just took my niece to dinner. She started classes yesterday, I think. So I'm like, oh, yay, new generation. It's very cute. And also felt very old taking the bus to campus to go look around. I don't know. It was a mixed emotion day for me the other day. But I currently live in Alaska, which is part of how I came to work with and know Tiana Teter, who's here with me today. Ana Herrera, who is also our co-author for this presentation, wasn't able to be here due to another work commitment, so she sends her regards. And we love Ana. If you ever have a chance to connect with her, she works for Sonoma Consulting now. She used to work with us, and she got this amazing job offer that nobody could refuse. So now we just consult with her, so we're lucky we still get to work with her. She's a wonderful human. And I'll let Tiana say a few words about who she is.
Hello, can you guys hear me okay? Hi everybody, my name is Tiana Teter. I am Koyukon Athabascan, and I am from Huslia, Alaska. It's a small village located kind of in the interior of the state. I am a part of the Caribou clan, and I currently reside in Fairbanks, Alaska with my 2 kids. I'm very happy to be here today and grateful to have this conversation with all of you. Last week, I graduated with my master's degree.
Woo! Thank you. Yeah, you have your degree after your name. Did you see that? Yes,
I have letters after my name.
First presentation with that on it.
So I'm so excited to have this conversation today.
Awesome. And Tiana just completed, and now I'm so excited at night, as much as I can be at 9 a.m. talking about data, but Tiana is coming to work with us full time, so we're very excited about this new chapter in our company's history. Yes, we do a lot of work in Alaska, and we do a lot of work with the tribes in Alaska, and obviously, as we'll talk about today, and as you all know, given what I've heard from all of you at this conference, right, you need to look like the communities that you work with, especially when you're a researcher and doing community research and data stuff. So we're super excited for the skills and the lived experience that Tiana is bringing to our team, especially because of our Alaska-based work. We're also giving her like California stuff too. We're throwing her in the ringer with that too. But okay, so first, remember, I'm going to read a little, but I'm just talking to you. Okay, so I'm going to try to do this. Combo is hard. So first, we're going to define data equity and discuss why collecting data with an equity lens is important, obviously, for preventing and addressing gender-based violence, and specifically sexual violence and assault. Then we're going to talk about what kind of data might be most relevant for designing and evaluating prevention interventions that address health disparities related to sexual violence. Then we're going to practice. I was telling some folks earlier too, like it's a heavy topic. Data equity is big, so we're trying to distill it and present opportunities for discussion and present some challenging questions, hopefully, to get us all thinking about doing this in a good way. So there's a lot of resources out there for data equity and what's also being called equitable evaluation. So what we did, so that's a Linktree QR code. We created a Linktree. I noticed some other folks have been doing that. It's a great resource. It's a great way to share resources. So at any time during our workshop or afterwards, you can access that Linktree. We've got a bunch of links to resources in the community. We've got our slide deck from this presentation. What else do we have? We've got the worksheets we're going to be using, plus some bonus worksheets we'll talk about later. We're not going to take the time for today, but that we highly recommend that you try to use. Oh, we also, on the QR code, I brought up like 3 copies of our workbook here. We're excited because we just published our 2nd edition of our planning and evaluation workbook. Excuse me. And we've intentionally tailored it more towards basically decolonizing evaluation and simple practices. This is our practitioner-oriented workbook. So basically, after all the decades of us like being in community with people, you know, it's just like, why can't we just talk about this in a simple way so that everyone has equitable access to these resources to be able to do good work in their communities? It shouldn't be shrouded in this, like all of our degrees. It makes me uncomfortable even to put our names up there with degrees. Like, yes, we have that privilege of education. We're coming to you with degrees, and also we're all humans here. We all have our lived experiences. We are all experts in our own experience. All right, David's going to come tell me to stop talking fast. But you wouldn't do that because you talk faster than me. Okay, so what is the purpose of data? Let's just throw a big question out there for everybody to get started with. Yeah, data is all of those things, and I'm gonna hopefully challenge some of us to think a little more broadly about what data is. So like your answer really makes me happy because it really isn't. And we actually, when I'm in community especially and not around a bunch of like academic or researcher folks, like I don't even use the word data. You don't have to use the word data. It's information, and then how you present, how you collect, how you use it, how you present it, how you share it. Like that information is data, and data is information. So it can be used for a lot of decisions. It can be used for a lot of good things. It can also lead to a lot of harmful implications. And so that is something that we're going to talk about today, how we can be better stewards of data. So I want to start with an example that's near and dear to the hearts of the people in the Bay Area, especially those folks in San Francisco. I lived here during 2005, which is when this kind of really hit the national news. So how many of you are aware of the dog breed restrictions in the city of San Francisco, the history of that over the last 20 years? Any of you? Okay, so there's a history of it, and in other parts of the country too, but San Francisco, I'd say in particular, hit the national news pretty early with it. So back in 2005, there was a dog-related fatality involving a young boy whose parent left him in the house with 2 pit bull breeds who were mating, and they killed the little boy. And so it made all the headlines, and San Francisco, everyone was obviously horrified. But San Francisco responded by categorizing all pit bulls almost immediately as a high-risk breed, and then instituted what's called a mandatory spay-neuter law, or an MSN law. And also many landlords disallowed bully breeds from living in their properties, just like bam, overnight. If you had a pit bull dog or a dog that looked like we can't, and that's for different reasons because they're smashy face, they can't breathe on planes, but it's similar to like plane restrictions with smashy face dogs. That's an official breed word. My partner and I, we have a smashy face Boston Terrier. She's such a cute little smashy face dog. They can't breathe, people. Okay, anyways. So they were all working for the assumption that dogs' breeds could predetermine a dog's behavior, right? So let's look at the data, right? So let's be honest, the data on bully breeds doesn't look great with regard to dog bites. Dogs with pit bull genes are unfortunately responsible for a majority of fatalities associated with dog bites. Now you'll notice I'm using the word fatality, not just the majority of dog bites, right? That would be a different chart. This is fatalities, and that's a whole different conversation. We can talk about why that might be. And between a 10-year period, 2010 and 21, of the 430 fatal dog bites, majority, not a huge majority, but 64% were pit bull breeds. Okay, so what had been done with data like this? Lots of things. We talked about some of them already. The biggest one that I think hits home with what we want to talk about today is the housing restriction laws, right? But also we're going to talk through an example of these neuter laws that went into effect. And again, as somebody was saying before, when a couple folks have talked when they're talking about child abuse prevention here at this conference, we're talking about like the intention is to protect children. We get that. But the actual impact could be very harmful in the way that we actually roll out a lot of these interventions, right? So again, like your intention versus impact, needs to be checked. So also the stereotypes started getting really negative for bully breeds. And it also looks like and felt like a story like this one. So Chris Cohn was walking his dog down the street here in the Sunset District neighborhood, which is over there. I think. And a uniformed animal control officer rolled up when he was crossing the street with his bully breed dog, and this officer said, "Have you neutered your dog?" Right? So called out like right there by an officer in plain daylight. So obviously that probably didn't feel very good for him. He was also a man of color, so double horrible. It kind of reminded me too of like COVID. So for me personally, as a white cisgender woman, when that was happening in the early 2000s, that was the first time I saw a lot of white people get really annoyed with being regulated. And I was like, Similar like with COVID, with all the, mostly I'll just say it, white people who are upset about wearing masks and mask requirements, right? Like, don't infringe. Like, yeah, so just a small taste of what it feels like for most people of color in this world, especially in this country. And I want to tie this back to data for us, right? So like this is tied to one data point. Bully breeds equal dog bite fatalities. So let's just let's like restrict all the bully breeds, and that's that. And basically it leads to some horrible profiling. Skip ahead 20 years later, more research, better research. Researchers who are looking at this with what I would consider a more equitable lens have collected a lot more data, and basically there's no correlation, no statistical significant correlation between pet dog genetics, so that's the one being walked across the street, right? Not a dog used for fighting, right? And threatening or biting behavior. Also, dog breed is not a reliable indicator of behavior. Sometimes it is an indicator, other times it's not. And I wouldn't even say indicator. Sometimes it is related to the behavior, sometimes it's not. And, sorry, I'm talking very fast. I just realized, sorry. Most mixed breed dogs had at least 4 different breeds, part of them. So to be able to visually, like I have, in addition to our little like smushy face Boston Terrier, we have a lab something mix pit bull. Like how many lab pit bull mixes have you seen? Like there's millions of them all over. He looks like a pit bull though, right? So, but he's got everything in him. So you can't just look at somebody or one of the dogs and say, that's a pit bull. I'm going to stop you as you walk across the crosswalk and profile you and charge you with a ticket or whatever else might happen when you violate that particular law. Instead, so contrast the stopping him when he's walking across the crosswalk approach, right? That's extreme profiling approach with what I would consider to be literally less judgmental or more non-judgmental approaches, like what's going on over in Oakland. So Oakland took a different approach, and hopefully San Francisco is doing something similar now. Somebody in there is with animal control, let us know. But they started these clinics where they would roll up in a van and offer information, spay, neuter appointments, surgery appointments. They'd offer education about dog training. They'd answer people's questions. They made it more of a community event and just showed up there. They didn't go to people and harass them. They didn't profile people. They just showed up and people came to them. And so it's a much different way of addressing a problem, and it also takes into account some different factors. And also the big thing that we're going to touch on too later today that it did was build relationship in the community. So you all came here to learn about data, but data is about relationships. And if it's not, it should be. So we're going to dig into this a little bit more. So let's connect this to sexual violence prevention. What does this have to do with this issue that we're here this week to talk more about? Is dog bite fatalities, are dog bite fatalities more complex or less complex than sexual violence or preventing sexual violence? Just think about it, you don't have to answer it, right? And in what ways? What are some of the factors that we take into account when we think about how are we going to prevent sexual violence from happening? Like norms, context, what else are we, age, sex, lots of different behaviors, lots of stereotypes come into play. But the part I really want to challenge us today to talk about, and that Tiana is going to help us with through an example in a few minutes, is what is the impact of our use of data? How will people's lives be negatively affected by our prevention initiatives as they become more so-called data-driven? We're learning so much now about the downsides and dangers of carceral approaches, right? And white people are finally seeing it, finally. need to a little more, I think. But the fact that criminalization has actually resulted in more harm to people in communities, more harm to entire communities. So how can we do this better? And how can we use more factors in someone's life, in communities, to be able to make better decisions and design better interventions to prevent sexual violence? So we're going to talk through some examples of what that could look like today, and hopefully do some of that in the worksheet that we're going to use at the end. I also want to challenge what we're calling data, which we already just did. Like, what are you calling data? And if the thing that comes to mind for you is statistics and charts, you got to pause and think bigger, and go look at some of the resources that we have in that link tree. Just Google online. I'm glad you're here. Let's start this conversation if you haven't started thinking about this now, but data is all around us, and it doesn't have to be a number. And by keeping things in numbers, we're honestly limiting its ability to help us be equitable in our work to begin with. Because you're stripping the humanity. You strip the humanity from that data when you turn it into a number, right? That's why stories and qualitative data is so rich. It brings the humanity back, brings the context back. So formally, data equity is a set of principles and practices to guide anyone who works with data through every step of a data project using a lens of justice, equity, and inclusivity. And data is not just an end goal, but a framing for all parts of the data work that you're doing, right? So it's both an outcome and a process. This is a theme I think you're going to hear more throughout this work. It's super important to understand. It's not a checkbox. It's not a thing that you accomplish and get a certificate. I'm trained in health equity data. I'm trained in data equity. Yeah, do that. And that's not real. You have to practice it. Practice. It has to become part of your way of moving through the world and looking at and seeing and using data. Tracking data such as socio-demographic variables like age, gender, socioeconomic status, those things help us understand the impact of violence on marginalized communities and can inform the development of more culturally relevant interventions. And in other words, we can't rely on just crime statistics, right? I mean, for 25 years, I've worked at national, federal level, but also as a local evaluator. And people are probably really sick of me saying, and you have to do it in a gentle way as an evaluator because you carry a lot of power as an evaluator. But to tell them, hey, rates of sexual assault is not your outcome. You can't reduce sexual assault rates or prevalence with a $30,000 grant for 2 years. Sorry. Right? And I'm glad RPE is doing a better job of trying to get, put some money into looking at more systemic inequalities and let's call that sexual violence prevention. Yeah, we're getting there. But yeah. We have some really good data that's available online. I want to give a shout out to NSVRC, the Sexual Violence Resource Center. They do have a lot of awesome data that they've summarized and made digestible on their website. Check them out. You'll also notice that most data, not just with their website, but in general with sexual violence, is prevalence data. How many people are being affected by this problem, and who are they, and how often? I won't say who. Sorry. How many people and how often is prevalence? Who are they? That's not prevalence data. Who are they is what we want to dig into today. And I think I'm going to turn it over to Tiana to give us an example of what this looks like in the real world.
Yeah, so now we're going to talk a little bit about what happens when data is missing or what happens when people go missing from data, specifically our missing and murdered Indigenous relatives. Can you guys still hear me okay? Okay. So I'm sure everybody in this room has heard of the MMIW movement or the MMIP movement, which is missing and murdered Indigenous people or persons, or the MMIWG, which is missing and murdered Indigenous women and girls. So I'll be using all three of those throughout this presentation when I'm talking. But this movement is actually where my interest in research and data started, because we often hear that Indigenous women are affected by violence and murder at higher rates than any other demographic of people, but we don't have the accurate numbers or statistics to show that it's a problem or to show how big of a problem it is. And how are we supposed to work on these issues, such as MMIP, if we don't have data to show that it's a problem? How did you...
Sorry.
Arrow? Yeah. Okay, so people can go missing from data in many different ways. One way being the correct race and ethnicity box is not being checked by law enforcement when they're creating their reports. And this is the standard 4-box option. In Alaska, we use white, black, Asian, and Indian. And those are the 4 options that police officers in Alaska are still using today. And an example of what this looks like and how it can become problematic is we recently had a person go missing in Alaska, and on their missing persons report, they were categorized as white, even though they were Alaska Native. And this can become an issue. This creates huge impacts because it shows that 1, law enforcement isn't properly investigating these missing people. 2, it shows that we don't have the accurate numbers to show that we're being disproportionately affected. That person just went missing in a data set. And we aren't able to show who is missing and from where. Now there's also another option that's never captured or reanalyzed, but it's used a lot of the times when creating these reports. One reason that it's there is for people with mixed heritage, but that option is never captured or reanalyzed, and it can be used in multiple scenarios. So for example, police officers, when they believe they could be accused of racial profiling, they won't ask what the race and ethnicity of a person is, and instead they just select that other box. Now, other issues that we have with reporting are names and the sex and gender box, which we won't get too into today, but those are just other options where people, specifically our two-spirited relatives, are completely going missing in the data. They're not there at all. And the collapsing of this data is problematic because, our Indigenous relatives go missing in the data sets, or they can become miscategorized. Misclassifications in data sets happen when murders are classified as a suicide by law enforcement. This happens most of the time in rural communities throughout the state where police don't want to have to travel to go into those rural communities and do a full investigation, so they'll just list it as a suicide. And there's also a lack of transparency. There's a lack of transparency and policy for law enforcement, which leads to a lack of accountability, and it affects reporting. So in this world of data equity and missing and murdered Indigenous people, we experience issues with data consistency, data collection, and data reporting. What data consistency looks like for us is jurisdiction, protocol variation, and the centralization and the digitization of data. But jurisdiction in Alaska is very complex, as I'm sure it is everywhere. But in Alaska, it is multidimensional and it is full of gaps, and people are constantly falling through those gaps. And one reason is because we have various layers of law enforcement, and this includes Alaska Police Departments, the Alaska State Troopers, village public safety officers, and sometimes the Federal Bureau of Investigation. And within each body of law enforcement, there might not be a standard procedure for filing a missing persons report, or it might not be clear how long a family has to wait before they can file a report. Has anybody ever heard you have to wait 24 hours before you can file a report? That's not true, but a lot of people don't know that because they're not clear on their procedures. And this becomes a data barrier because all of these organizations are collecting different information, but they're not communicating with one another, and they're not making it easy to navigate for the families or the relatives of that missing person. And it can become difficult for tribes to navigate these systems when they're trying to advocate for their Indigenous people. And on top of that, we have issues with the centralization and the digitization of data. And this lack of centralized data leads to missing data, and it means reports can't be generated at a community or an agency level. And oftentimes, these reports aren't being digitized, and they can't even be used at a systems level. So people aren't able to gather that data to show this is how many people are missing, and this is where they're from. So because of problems like that, MMIWG data is absent, it's often inaccurate, and it's not accessible to communities.
some of the best work with regard to this idea and definition and helping people practice data equity and what's also being called equitable evaluation at this point is being done by folks right here. Actually, I'm going to talk a little bit about something else just real quick, sorry. I wanted to address this kind of larger field issue. So talking about equity within the lens of, or the work of use of data is becoming more popular, as I'm glad it is. It needs to be. But because of that, there's, like I said, there's lots of stuff out there. It can feel like you're drinking from a faucet when you Google or go online and look for information. So just take it with a little bit of a grain of salt. People are trying things out as they talk about equity and what it means. Hopefully today you'll walk out of this workshop with an understanding of that is basically working towards the same thing. So data equity and equitable evaluation are like close sisters. They talk to each other a lot, right? Evaluation uses data in all its forms, even sometimes things that you work on that you might not consider to be evaluation, like a needs assessment. It can be considered evaluation. It's a type of formative evaluation, especially if it's informing the design or implementation of a program or initiative or policy, right? So equitable evaluation is a wonderful field to look into and learn about. We're going to share a couple resources. Same with culturally responsive evaluation. It's another close sister to the other two. We have a worksheet in our materials on that link tree that Anna actually put together, Anna Herrera, who isn't here today, but is part of this workshop, to help folks reflect on who they are in this work, which is part of the first step of doing culturally responsive evaluation. The Bay Area's own Geraldine Coffey and the Equitable Evaluation Initiative have reminded us that the work begins by acknowledging our own complicities in and contributions to the current paradigm, so the current way in which things are done, and accepting that we are a tool for change. The work, so-called work, is within us and between us, right? Shifting this large of an evaluation paradigm takes intentionality, discipline, and practice. And with that in mind, approach this with a learning mindset and open heart. I love Geraldine Coffey's work. She lives here in the Bay Area. If you haven't had a chance to work with her, she and her group are amazing. And they've put together, they work mostly with foundations, but she has some great resources online, especially through the Equitable Evaluation Initiative. Oops, I skipped one. This other reminder is one that I also love. Anna put this in our workbook when she helped write the culturally responsive evaluation section of our workbook. This quote from Anais Nin, that we don't see the world as it is, we see it as we are, okay? So our culture and identity are going to influence the way we see, think, communicate, and use data. So simply, like if program participants come from a different lived experience or culture than your own, do you think they might read questions and answer questions that you've created differently than you might? Yes, absolutely, right? So how can you think about how you're asking the question that's giving you this so-called data, right? The step, right? That's why we say this is a process. It's every step of this process of using data, not just using or looking at a chart. It's also how you collect the data. And obviously the answer to doing this better is to talk to the people directly, right? Like you have to involve people who you're designing a program or initiative to help or address. You have to involve them in the process from the very beginning and creating the questions to figuring out what questions should be asked. Is it even a problem? Maybe it's not even a problem. And I love that folks at this conference have been talking a lot about this, and I know you're a savvy crowd, so I'm not gonna say too much about it, but I just wanna reemphasize that it has to be built on relationships. Data collection has to be built on relationships and talking to the people that you're collecting the data with or for, on behalf of, or whom it will impact. And that's another stretch. You have to be responsible and think about who this is actually going to be impacting. Think back to the bully breed issue with San Francisco, right? You know it was with good intentions to protect kids and not have them be killed by dogs. But the way it actually was lived out, the impact of these policies that were put into place were incredibly restrictive and harmful to families, to people who wanted to find affordable housing, and they just happened to have a very sweet, by the way, pit bull dog, And now they all, like most of the housing that was in their range of affordability was now out of the question, almost overnight. So it impacts things like housing. So hopefully you can avoid some of those long-term negative impacts when you actually involve people in the solution who might be affected by whatever solution it is. The Equitable Evaluation Initiative has come up with 3 helpful principles. By the way, we have their principles on that list of resources in that link tree, and I'll give you the QR code at the end again. But they have 3 helpful principles to remember as you're working with data and evaluation. First being that evaluation should be in the service of equity at every step in the use of data. The evaluation work should be designed and implemented with the values underlying equity work, meaning it needs to be multiculturally valid, oriented toward partnership and community ownership. And finally, evaluation can and should answer critical questions. And here's the key. I love this because it's really asking big questions, but we're here for it. We have to ask questions about the ways in which historical and structural decisions have contributed to the condition to be addressed. There's a history there. Somebody has asked that question before or thought about addressing it before you. So find out who that was and what information did they collect. Bring them to the table, or you go to their table. Better yet, go find out. You knock on their door, you take them out for coffee or a meal and ask for their help. The effect of a strategy on different populations, so this is another one of the questions we need to be asking, the effect of a strategy on different populations and on the underlying systemic drivers of inequity. And ask in what ways cultural context is tangled up in both the structural conditions and the change initiative itself. So, big principles to keep in mind. Absolutely essential. I encourage you to go look at the Equitable Evaluation Framework. We have that as a resource. Go check out their website. It's an awesome resource. One of my favorite tricks to just working with data and practicing equity is, like, this is step 1, basic. You should always be looking to how you can disaggregate your data. How many of you are trained in academia as like researchers? You took statistics classes, you've like data folks, great. So this is something like this word disaggregate your data. Like this is something that you hopefully were taught in a statistics class, right? But then I think, in my personal experience, you kind of quickly forget about it, especially as you start working in communities and like things happen fast. You're responding to grants, you're writing reports, bam, bam, bam. And of course your funder wants to know, have you reduced rates of sexual assault with our $30,000? No. But let me tell you about these risk and protective factors we're addressing and like how we're actually moving the needle in these other ways that lead to this. And where's my $10 million to actually reduce prevalence? But anyways, disaggregating data is a great trick, and you should always be doing it. I did use the word should. Again, sorry, I'm like really judgmental. I'm like, I feel passionate about this issue. Sorry. I want you all consider disaggregating your data. And this needs to be done through the internal process of looking at your data, but also the external process of sharing your data and the visualization of your data, right? We're going to see some examples here of visualization. There's lots of awesome examples of how when you share data visually, so AKA data visualization, it's a thing. You can also Google that, learn a lot. There's lots of cool resources now on data visualization. By the way, Canva, which we're using for PowerPoint, for this presentation, is a fantastic resource for visualizing some parts of data, but also just communicating reports and data in a way that is, I find, much more inclusive. And our team now we just subscribe to their things. It's a really useful tool. But data visualization affects representation, which obviously then impacts the actual way that we address and prevent issues in communities, right? Because if you don't see it, you won't address it, right? That's what a lot of us white cisgender folks deal with all the time, right? Like if you're part of the majority, if you don't see what's going on, if you don't recognize it and take the time to stop and say, oh my God, yeah, I never saw that, but this is the reality for people who are not me. That's what data visualization starts to do. You start to bring in and visualize what's really going on with whatever issue you're addressing. And Tiana's gonna talk a little more about that. I'll put you on that slide.
I also just want to say that we really struggled trying to find a visual aid or some kind of chart or graph to show an issue like this because, again, it's just not out there. So luckily, we were able to find this. And this is a great example of desegregating your data. So about 20% of women in the United States have experienced completed or attempted rape during their lifetime. And let's desegregate that and see what it looks like. More than 56% of Alaska Native women have experienced completed or attempted rape during their lifetime, and that's more than half, and that's only reported cases. And I think we're all familiar with the high numbers and high statistics that Alaska Native and American Indian women experience. They experience rates of violence at much higher rates than other demographics of people. And these are just, again, just reported sexual assaults in the country. But if you think about this, if you take a closer look at it, if you hear that more than half of Alaska Native and American Indian women are experiencing this type of violence, what assumptions are you making? What stereotypes are you hearing? What kind of prevention work are you seeing? Because in my experience as an Alaska Native woman and as somebody in this work, I often hear that Native men are violent men, or that's a problem that's just happening in that family, in that community, in that village in Alaska. But that's not the case.
I get asked all the time as a white person in Alaska, oh, you work with domestic violence, sexual assault. Oh, yeah, it's a big problem up there. What's wrong with all those Native people? Mm-hmm. Very blunt and racist.
But if you look at it, 96% of American Indian and Alaska Native victims of sexual violence experience violence at the hands of a non-Native perpetrator. And the perpetrators of sexual violence crimes against all Native American victims are predominantly white men. And this changes everything. This changes the prevention work that you see. This changes the information that you're hearing. This changes policy. And an example of this is, for the first time, the 2022 reauthorization of the Violence Against Women Act, VAWA, included provisions that reaffirmed tribes' power to exercise jurisdiction on non-Native perpetrators of violence. So for the first time, they were able to charge these criminals with these crimes. And it changed the scope of work that you see in Alaska. It changed prevention work. Rather than just hearing education going into communities about how to prevent child sexual abuse, you're hearing work done around trafficking. You're hearing more information on online safety. You're hearing people express that Alaska Native women, if you're brown and if you have long brown hair, you're more likely to be targeted at an airport. And so you're getting this information on trafficking, and it's pretty new to Alaska. I've only been in this work for a few years, but I'd say like just within the last 3, we've started talking about trafficking more. I'll hand it back to you.
Yeah. And we wanted to share, sorry, that was loud. An example, there's some data providers now. So like Tiana said, we had, I did find a chart that was like bad resolution that showed, how, like the difference between disaggregated data, like for an entire racial ethnic group versus disaggregating it down into subgroups, and how that tells a different story. And just like Tiana did, she kind of helped tell the story of, taking the shock value from the stat we all hear about like the highest rates of sexual violence occur within Alaska Native and American Indian women, but digging deeper into the context. Why, how, who's doing this? Where is it happening? There's entire providers here, or data providers, I don't know what they call themselves, honestly, but if anybody here is part of one, I'd love to hear more about it. But you can find some folks that's purpose is to provide data. There's Statistica is one random one online that I found. It was okay, they had like 3 stats on sexual violence. I was like, oh, that's not gonna cut it. Plus we already know those stats. It's the same prevalence stats we see all the time, right? Like we're trying to look under, like below the prevalence stats into context, into how it's happening, among who, when, why, all the details that we need to understand to design responses. Detroit has this group called Data Driven Detroit. So cool. I wish all areas had this kind of an initiative, and maybe San Francisco or the Bay Area does, I'm not aware. But they've actually adjusted their own use of and display, remember that data visualization, their display of data to be more equitable. So one example was, sorry, I talked a little more, so I skipped ahead of myself. So during the foreclosure crisis of the early 2000s in Detroit, D3 is how they call themselves. D3 changed their work to include real-time data on evictions that was particularly acute. So they had previously relied on just federal data sets, but they started, such as the American Community Survey, aka the census, but they started working with local data to enable them to provide more relevant and timely data analysis to decision makers, such as local vacancy rates, tax foreclosures. They started digging into what does housing crisis mean with regard to how it shows up in the data. It results in more foreclosures, more vacancy rates, et cetera. Also with the pandemic, they shifted their way of providing data. So they started compiling COVID-19 case and death rates with other contextual indicators, not just the rate of how many people died of COVID or had COVID. They started connecting it with other contextual indicators, such as asthma-related hospital visits to determine medical vulnerability, because they understood that data on COVID-19 cases and deaths alone would not sufficiently capture this. And if you've ever, I worked in Detroit when I went to Michigan, and they have a big problem, again, a great example of health disparity with one of their freeways that was built right through Southwest Detroit, right through the Latinx community, right? And so, you know, of the many issues that caused among that particular culturally specific community, one was an uptick in asthma, right? There's lots of folks at University of Michigan that study this with public health. Asthma, adverse health effects, and it's from truck traffic, right? All the exhausts, everything dumping on the town that's right next to the freeway. So data providers can look at other rates and not just who has asthma, but even more than that, like visits to different health clinics, and also collecting raw data to help that. So look for in your area if there's a data group like this, and hopefully they're also being more equitable and providing more contextual data. And hopefully you are, you know, we do have these resources in that link tree. You have access to them. It's things like, you know, how do you ask yourself questions to do more culturally relevant evaluation, knowing yourself first. This worksheet helps walk you through it. Who are you? Just a few questions and I always recommend people, you know, go make a cup of tea or coffee or eat a piece of pizza or cake, whatever makes you happy. Sit down and just walk through these questions by yourself. You know, it's a personal journey. You have to look inward and know where you are showing up in the data. So this is a worksheet to help ask some of those questions. There's also whole guides out there. Oops, sorry. Like the Urban Institute has done a really great guide on data visualization. Go check them out. We have that in our list of resources too. You can access that online. And if you do want to do the checklist, right, like it's not a checklist, but it is a checklist, but it's not, you can also access some really good checklists. So the Learning for Action group has put together a series of really good checklists. They're thorough, like our team has done a few of them. I don't know at our last retreat if you did that with our team yet or not. We will. We always bring it back to our retreats because it's so much to work through. We just take a chunk of it at a time. To practice asking ourselves if we're doing certain things throughout the evaluation process on any of our evaluation projects. Again, it's more than a checklist, but it's a starting place if it's helpful for your team to have a place to start like that, in addition to the personal work. And that's what we have for you. So that's the Linktree QR code, and thank you very much.